The persistent chest pain started 3 months ago, but I'd learned not to mention health concerns around my family. At 28, I was supposedly the dramatic sibling who overreacted to everything, while my younger brother Marcus was the golden child pursuing his surgical residency at Metropolitan Medical Center. "Seriously, Emma, you're being ridiculous again," Marcus had said during our last family dinner when I mentioned feeling unwell. "Some people have real medical training. Maybe trust the actual doctor in the family instead of Googling symptoms like a hypochondriac." Our parents nodded approvingly. Dad clapped Marcus on the shoulder. "That's our future surgeon talking sense." What they didn't know was that I'd been quietly building something significant while they dismissed my marketing consulting as playing with computers. My healthcare technology firm, Neural Diagnostics, had developed AI algorithms that were revolutionizing cardiac imaging interpretation. We'd secured partnerships with 15 major medical centers, including the hospital where Marcus was training. The chest pain worsened last Tuesday. Sharp, radiating sensations that made me dizzy during client meetings. I finally scheduled an appointment with Dr. Sarah Chin, a cardiologist I'd met through our professional network. "Emma, these symptoms combined with your family history are concerning," Dr. Chin said after reviewing my tests. "We need immediate imaging and blood work." I texted our family group chat about missing Thursday dinner due to medical appointments. The responses were predictably dismissive. "Mom, hope it's nothing serious, honey. Try not to stress yourself out." "Dad, remember what Marcus always says about medical anxiety." "Marcus, here we go again." Face with rolling eyes. Thursday morning, the emergency room at Metropolitan Medical Center was bustling when my test results came back abnormal. Dr. Chin had admitted me for observation after discovering irregular cardiac rhythms that could indicate a serious underlying condition. I was lying in the cardiac unit connected to monitors when Marcus walked in wearing his scrubs. He'd obviously heard through hospital gossip that someone with my last name had been admitted. "Really, Emma? For anxiety attacks." He shook his head dramatically. "This is exactly the kind of healthcare waste I'm learning to identify in my surgical rotation." "Marcus, Dr. Chin found some irregularities." "Dr. Chin is being overly cautious because you're young and convinced something's wrong. Trust me, I see this constantly. Healthy people who watch too many medical shows and think every chest twinge is a heart attack." He pulled out his phone and started typing. "I'm texting Mom and Dad that you're fine, just being your usual dramatic self. Maybe this will finally teach you to stop wasting medical resources." "I didn't ask to be here," I said quietly. "Right. You just happened to convince a cardiologist that your anxiety needed emergency intervention." Marcus crossed his arms. "Look, I'm trying to build a career here. Having my sister creating drama in my own hospital is embarrassing. The other residents are going to think medical hysteria runs in our family." He gestured around the cardiac unit. "Do you see how busy this place is? Real patients need these beds, Emma. People with actual emergencies, not worried millennials with stress-related chest tightness." Dr. Chin said. "I don't care what Dr. Chin said to make you feel better. I care about what the actual data shows, and stress-induced symptoms in young women are incredibly common. You're taking up space that could be used for someone having an actual cardiac event." My phone buzzed with messages from our parents, clearly based on Marcus's report. "Mom, feel better soon, sweetheart. Try some relaxation techniques." "Dad, Marcus says you're doing fine. Good thing he was there to provide some medical perspective." Marcus noticed me reading the messages and smiled smugly. "See? I saved everyone from unnecessary panic. Sometimes family members need a medical professional to put things in perspective." He checked his watch. "I've got surgery in an hour. Try not to create any more drama before you get discharged for anxiety, okay? Some of us have actual medical careers to maintain." After he left, I lay there staring at the ceiling, listening to my irregular heartbeat on the monitor. The irony wasn't lost on me. Marcus had no idea that his residency program's funding, evaluation system, and continuing education requirements all flowed through partnerships my company had developed with Metropolitan Medical Center. In fact, his dismissive attitude toward patient concerns would make for an interesting case study in our monthly residency performance reviews. Dr. Chin returned Friday morning with additional test results and a concerned expression. "Emma, we've identified significant cardiac arrhythmias that require immediate intervention. You have a condition called Brugada syndrome. It's genetic and potentially life-threatening. Is that why? Yes, the chest pain, dizziness, and irregular rhythms all fit. This isn't anxiety or stress. This is a serious cardiac condition that can cause sudden cardiac death if untreated. She sat down beside my bed. We need to discuss implanting a cardiac defibrillator. The weight of her words settled over me. While Marcus had been dismissing my symptoms as health anxiety, I'd been walking around with a potentially fatal heart condition. Dr. Chen, how common is it for young people to have this condition misdiagnosed or dismissed? Unfortunately, too common. Many patients, especially young women, are told their symptoms are anxiety-related. That's actually one of the quality improvement initiatives we're implementing through your company's AI diagnostic tools. I nodded slowly. About that, I haven't been entirely transparent about my role at Neural Diagnostics. What do you mean? I'm not just a consultant. I'm the founder and We've been developing the cardiac imaging AI specifically to catch conditions like mine that get missed in traditional evaluations. Dr. Chen's eyes widened. You're Emma Rodriguez? The Emma Rodriguez who designed the arrhythmia detect algorithm we've been piloting. That's me. Your system has already helped us identify 12 cases of previously undiagnosed cardiac conditions in young adults this month alone. The accuracy improvements are remarkable. Before I could respond, Marcus appeared in the doorway again, this time with 2 other residents trailing behind him. Emma, these are my colleagues, Dr. Martinez and Dr. Williams. I was telling them about your anxiety presentation yesterday. He turned to his colleagues. Classic example of how psychological symptoms can mimic cardiac distress. Dr. Chen stood up, her expression shifting to something cooler. Excuse me, are you a family member? I'm her brother, Marcus Rodriguez. Surgical resident here at Metro. I was explaining to my colleagues how family members can sometimes provide context about a patient's psychological history. And what's your involvement in this patient's cardiac care? Marcus faltered slightly. Well, I'm not directly involved, but as a medical professional and family member, I thought I should provide some background about her tendency toward health anxiety. Dr. Rodriguez. Dr. Chen's voice carried unmistakable authority. Are you part of this patient's treatment team? Not technically, but... Then you have no business discussing this patient's case with colleagues or making diagnostic assumptions. This patient has been diagnosed with Brugada syndrome, a serious cardiac condition requiring immediate intervention. The 2 residents exchanged glances. Dr. Martinez stepped forward. Brugada syndrome? That's the condition Dr. Kim was lecturing about last week. The one that gets misdiagnosed as anxiety in young adults. Exactly. Dr. Chen's tone was crisp. This patient's symptoms were completely consistent with cardiac arrhythmias, not psychological distress. Marcus's face was reddening. I was just trying to provide helpful context. By discussing a patient's private medical information with colleagues who aren't on her treatment team? And by making incorrect diagnostic assumptions based on your personal biases rather than clinical evidence. The silence stretched uncomfortably. Finally, Dr. Williams cleared his throat. Maybe we should get back to rounds. Good idea, Dr. Chen agreed. Dr. Rodriguez, I'd like to speak with you privately about appropriate professional boundaries. After the other residents left, Marcus turned to me, his earlier smugness completely gone. Emma, I didn't realize that I actually had a serious medical condition? That your medical expertise was wrong? Or that discussing patients inappropriately with colleagues might be a problem? Dr. Chen consulted her tablet. Dr. Rodriguez, what year of residency are you? 2nd year surgical. I see. Well, this interaction will need to be documented for your evaluation file. Patient confidentiality violations and diagnostic bias are serious concerns for any medical professional. Marcus looked between us, clearly calculating the implications. Dr. Chen, I was just trying to help provide context as a family member. Your role as a family member doesn't override your professional obligations. If anything, it requires higher standards of behavior. After Dr. Chen left to arrange my cardiac procedure, Marcus sat down heavily in the visitor chair. Emma, I'm sorry. I genuinely thought. You thought you knew better than the attending cardiologist because you've spent 2 years learning to cut people open? That's not fair. What's not fair is having my brother announce to his colleagues that I'm a hypochondriac while I'm lying here with a potentially fatal heart condition. Marcus stared at his hands. How was I supposed to know? By listening instead of assuming. By trusting the actual cardiologist. By not treating your sister like an inconvenience to your career. Monday morning I was back at Neural Diagnostics headquarters, recovering from my cardiac defibrillator implantation and preparing for our quarterly medical center partnership reviews. As CO, I personally oversaw evaluations for all residency programs receiving our funding and technology support. Metropolitan Medical Center's residency evaluation meeting was scheduled for 2 p.m. Dr. Patricia Williams, the hospital's chief of medical education, had requested an urgent discussion about professional conduct concerns in their surgical program. Emma, we've had an incident involving one of our second-year surgical residents, Dr. Williams began as we settled into the conference room. Dr. Marcus Rodriguez has been reported for patient confidentiality violations and inappropriate diagnostic assumptions. I kept my expression neutral. What kind of violations? He discussed a patient's private medical information with colleagues who weren't on the treatment team, and he made unauthorized diagnostic assumptions that contradicted the attending physician's clinical assessment. She consulted her notes. The patient was later diagnosed with a serious cardiac condition that Dr. Rodriguez had incorrectly attributed to psychological factors. Dr. James Harrison, the hospital's chief medical officer, leaned forward. What makes this particularly concerning is that this represents exactly the kind of diagnostic bias your arrhythmia detect system is designed to prevent. A young patient with genuine cardiac symptoms being dismissed as anxious. The irony is significant, I agreed. Our partnership specifically targets improving diagnostic accuracy for conditions that get misdiagnosed due to age and gender bias. Dr. Williams nodded. Dr. Rodriguez's behavior directly undermines the quality improvement initiatives we're implementing through your technology platform. We can't have residents perpetuating the exact problems we're trying to solve. What are you recommending? We're considering suspending his residency pending a formal review. Patient confidentiality violations are grounds for dismissal from medical training. Dr. Harrison added, we also discovered he's been making disparaging comments about patients seeking cardiac care, calling legitimate emergency visits healthcare waste and medical drama. This attitude is completely incompatible with professional medical practice. I reviewed the documentation they'd provided. Marcus's resident evaluation file painted a picture of someone more concerned with appearing knowledgeable than actually listening to patients or colleagues. Dr. Rodriguez seems to believe his limited clinical experience supersedes attending physician judgment, Dr. Williams continued. That level of arrogance is dangerous in medical practice. What does his clinical performance look like otherwise? Mediocre. His surgical skills are adequate, but his patient interaction scores are consistently low. Multiple attendings have noted his dismissive attitude toward patients he considers uninteresting or routine. Dr. Harrison pulled up additional reports on his tablet. 3 other patients have filed complaints about feeling dismissed or judged by Dr. Rodriguez during their care. All were young women with symptoms he deemed psychological. And now we discover that one of those psychological cases was actually his own sister, who was correctly diagnosed with a potentially fatal cardiac condition by Dr. Chen, Dr. Williams added. The ethics violation is clear, I said finally. Patient confidentiality breaches, inappropriate diagnostic assumptions, and a pattern of dismissive behavior toward patients based on demographic bias. Dr. Harrison nodded. We're recommending immediate suspension from the residency program. Medical professionals who can't respect patient dignity and clinical protocols pose a risk to patient safety. I'll support whatever decision prioritizes patient care and professional standards, I replied, signing the evaluation documents. Thank you, Emma. Your company's diagnostic tools are helping us identify not just medical conditions, but problematic clinical attitudes that need addressing. As I signed Marcus's residency termination paperwork, I thought about irony. He'd spent years dismissing my dramatic health concerns while I was building the very system that would expose his professional shortcomings. The call came that evening while I was reviewing patient safety protocols at home. Emma. Marcus's voice was shaky. I need to talk to you. I assume you heard about your residency status. They suspended me, pending a full ethics review that could end my medical career. He paused. They said it was related to patient confidentiality violations and diagnostic bias. Those are serious charges. Emma, I know I was wrong about your condition. Dr. Chin explained how dangerous Brugada syndrome is, how many people die because it gets misdiagnosed as anxiety. His voice cracked. I could have contributed to you dying because I was too arrogant to listen. Yes, you could have. But why didn't you tell me who you were? That you owned the company providing our hospital's technology. I leaned back in my chair, feeling the slight weight of my new cardiac defibrillator. When would that have been appropriate, Marcus? When you were announcing to your colleagues that I was wasting medical resources. When you were texting our parents that I was being dramatic. I thought I was protecting the family from unnecessary worry. You were protecting your ego. You couldn't stand the possibility that your anxious sister might actually know something about medicine. The silence stretched between us. Emma, can you help me appeal this? Talk to the hospital administrators. Marcus, I signed your termination paperwork this afternoon. What do you mean? Neural Diagnostics provides funding and oversight for Metropolitan's residency programs. I'm the CEO who evaluates professional conduct standards. The phone went quiet for a long moment. You're the person who decides residency funding? Among other responsibilities. So when I was bragging about my medical career while you were having cardiac episodes, you already knew that my career literally depended on your approval? I did. When he spoke again, his voice was barely a whisper. How long have you been successful? 5 years. Since I founded the company. And you never said anything? You never asked. You were too busy explaining why my work didn't matter and my health concerns were imaginary. The call ended without goodbyes. Later, I heard through family channels that Marcus had been forced to move back in with our parents after losing his residency stipend. I was building the future of cardiac care one algorithm at a time. Some people just shouldn't become doctors.